Let's start with our first segment, initial screening by general practitioner. Obviously, our clinical journey begins with our general practitioner, maybe in an annual physical exam, or whenever we have certain symptoms, we generally call up our family doctor, aka our general practitioner. But one surprising fact that I mentioned in our previous episode is that our general practitioner is a general practitioner. The doctor may not be a specialist in GI issues and may not be able to diagnose correctly. However, there are fundamental screenings that GP can order in order to make sure that at least certain causes are ruled out, or at least one prevalent one or simple causes could be diagnosed very easily. So let's go by one. The number one is complete blood count. So which assesses overall health and detect disorders like anemia and infections, which can influence gastrointestinal symptoms such as chronic constipation. And a CBC is a fundamental test that provides a snapshot of our overall health. It can reveal underlying issues such as anemia, which is low red blood cells count, and infection, which is high white blood cell count, and that may contribute to gastrointestinal symptoms like chronic constipation. So CBC measures several components of our blood. Number one, red blood cells. Number two, white blood cells. Three, hemoglobin. Number four, hematocrit. Number five, platelets. So a small blood sample is taken from a vein, typically in our arm. Then the blood is sent to the laboratory for testing, for analysis. And generally, a CBC is often a part of a routine physical examination or order when you have symptoms like fatigue, weakness, inflammation, or infection that could be related to the gastrointestinal issues. So let's get the first blood panel done, which is CBC, and maybe one of those tests will come out positive or lower or higher than we anticipated, and that could help us begin our trial and error understanding and pinpointing the root cause. And number two testing is celiac disease screening. So most of us, not most, but some of may have celiac disease or gluten allergy. And the purpose of celiac disease screening is to diagnose celiac disease, which is an autoimmune trigger condition triggered by gluten. So includes serologic test for anti-tissue transglutaminase antibodies, TTG, IgA, and possibly endomysial antibody test. Then celiac disease can cause chronic gastrointestinal symptoms such as chronic constipation, diarrhea, and abdominal pain. And screening helps identify whether gluten or protein found in wheat, barley, rye is triggering the symptoms. And again, it may not be by GP, it can be ordered by the gastroenterologist as well, but it could be one of the initial screenings. So screenings include, again, two parts, anti-tissue transglutaminase antibodies, which is TTG, IgA, or endomysial antibody test. Again, it's done through blood test, and generally this is recommended when there is a persistent gastrointestinal symptom. So for me personally, I did not get tested for celiac disease. The reason why I took the record of my dietary habits and I did not find any correlation when I eat wheat and my symptoms. So it wasn't necessary for me to take it. Or now let's talk about third test, which is fecal occult blood test, which is also initial screening, which detects the hidden blood in the stool, indicating conditions like colon cancer, ulcers, polyps, or colitis. So blood in the stool can be a serious condition including colorectal cancer, which may not be visible to the naked eye. Early detection to FOBT can lead to timely treatment and better outcomes. And also, blood in the stool also can be because of hemorrhoids, fissures, and so on. Again, depending on the color of the color of the stool, we can determine if it's visible to naked eye. But again, FOBT is for individual through naked eye. Again, it can be done at home or it can be done at lab. So it's typically recommended for individuals over age of 50 as part of the routine colorectal cancer screening for those with unexplained gastrointestinal symptoms. And number four is obviously dietary and lifestyle history. I have also talked about in our home test as well. But again, with your GP, we can go walk through with what are the diets, lifestyles, and we talk about. And then when you keep a record of it, you're able to analyze what's typically causing it, and discussing that with your GP will helpful. And especially when you can talk about stimulants such as alcohol, coffee. We talk about fiber. We can talk about the how you're chewing and so on. Next thing we talk about is fourth thing is physical activity assessment. I told you earlier in at home test also that sedentary lifestyle can be the cause of it. So you can talk about steps, exercise, and so on that you can measure, and whether how that is correlating with the symptoms exacerbation. Another one is the medication review. So it detect the medication reviews such as anticholinergics, narcotics, antidepressants, NSAIDs, calcium blockers, psychotropic drugs, iron supplements, bismuth containing medication that can cause constipation. So when you're having chronic constipation, keeping a record when you started the medication, what were the symptoms of it, and discussing that with your GP or gastroenterologist. And then they can obviously do the one of the three things. One, obviously they can talk about the how the drugs is interacting. That's number one. Second is they can obviously discuss the entire medication review with you. Third one is based on the interaction and the review, they can prescribe alternatives or change the doses personalized to your body, so that you don't have any chronic constipation as well. Hence, discussing these six initial screenings with your general practitioner will be immensely helpful to diagnose the most common and prevalent causes of it. And obviously, the general practitioner is going to navigate or refer you to the gastroenterologist. And when you go to gastroenterologist, you may have these foundational screenings done, and that can create a baseline for a conversation with your gastroenterologist.